Health insurance in Winfield, Kansas. Despite decades of migration to cities and suburbs, millions of Americans still live in rural areas. Many of them are uninsured. In some rural areas there are relatively high levels of poverty. Most people rely on community health centers for their health care, but they are often far away and underfunded. The recently passed healthcare reform bill includes money for the expansion or building of such centers. How does healthcare reform affect them? First, it will provide subsidies and tax credits for low and middle-income individuals and families to buy a health insurance plan. Access to health coverage has been shown to improve health outcomes. Patients take more advantage of preventative care instead of waiting until their conditions get serious enough to visit an emergency room, which is often less expensive in the long run. It also expands the Medicaid insurance program for those below at or near the poverty level. However, just being insured isn't enough. What good is a health insurance plan if the closest doctor is a full day's drive away? That is why the bill creates incentives for physicians to practice in rural areas. It enacts more scholarships as well as a federal loan repayment program for medical school graduates who agree to work in underserved areas. Up to $35,000 of their student loans, a significant chunk of their debt, will be forgiven. This program will encourage more doctors to work in rural locations they may have considered less attractive. Moreover, there will be much more support for the training of primary care physicians. Those are the doctors that will be needed most after rural patients buy a new health insurance plan. Currently, many doctors choose to go into specialties such as orthopedics because of the higher compensation levels and decreased stress. Many doctors have no other choice because they are so indebted to their education. Otherwise, they would not finish paying off their loans until retirement. Since training to become a primary care physician is equally costly as specialty training, student loan repayments for the former will be limited to 10% of a doctor's annual income. Not to mention they will be forgiven after 20 years for those who stay current on their payments. In addition, health insurance reform legislation aims to pay an extra 10% incentive to primary care doctors. Technology funded by the legislation may also help those living in rural areas. Telehealth services allow for basic consultations with doctors and other professionals. The nation's best doctors will be able to see patients virtually through webcams and determine whether further specialized treatment is needed at a lower expense than in-person visits. Medicare can also use telehealth technologies to determine eligibility for durable medical equipment and home health services far quicker than the process would otherwise take due to the need for travel.